What is the main aim behind this conference? Of course, it's not the first, it is the 8th conference.
Maybe you'd go.
Yes. Of course, the objective is to brainstorm around reproductive systems in relation to cancer. As we all are aware, there is a stigma around cancer. And there is a belief that automatically if you have got a cancer, you will die. The aim is to raise awareness that indeed, if it is detected in time, it can be cured. That's number one. And we are also looking at other methodologies and practices that have elsewhere been very successful and share that scientific experience during the discussions. On the other hand, at the political level, we wish to raise conscience at the political level, because the conference is going to be attended by, up to now, about 18 first ladies have confirmed. There would be speakers of the parliament and at the same time ministers of health, as well as many parliamentarians will attend the conference. We also anticipate that from Namibia, councillors, traditional leaders, some religious leaders will also be attending this conference. So we hope to raise awareness and benefit from experiences elsewhere.
Across different spheres.
Yeah, that's right.
Of course, we've been talking about this conference and the build-up over the last couple of weeks. We've had Usi in the studio, we've had Renette in the studio from the Cancer Association, taking a look at the status of cancer. But statistically speaking, Doctor, what is our situation in Namibia when it comes to breast cancer, cervical cancer, of course, for women, and then prostate cancer for men?
I think Namibia, thank you for the question, Namibia sits like most of the other African countries when it comes to issues of cancer. If you were to backtrack like 10, 15 years ago, Africans did not think cancer was a problem for them. It was more or less seen as a situation of developed countries. And so some of the challenges around cancer comes, first of all, in terms of the record keeping, in terms of cancer registries and taking notes. And so if you look at some of the statistics we do have, which is from 2008, tells us that globally, in 2008, if we look at the issues of cervical cancer, we had about 580,000 new cases in the year 2008, of which about 275,000 of them died. 90% of those were from developed countries. In that same year, about 75,000 cases happened in Africa, and about 50,000 deaths. Now, it is projected that for us on the African continent, we're going to be sitting with about 1.6 million cases of cancer by the year 2030, with 1.2 million deaths. So increasingly in every of the African countries, as in developing countries across the continent, including Namibia, the incidence of cancer is increasingly on the rise. And like the PS had said, sometimes people miss it. Clinicians themselves sometimes may detect late. And so it's important to begin to draw everybody's attention to it. Unfortunately, we're no longer invincible to cancer. And so we need to be aware it's real. We need to be aware it's with us. We need to be aware that we need to do something. And may I add, cancer is a chronic illness, which therefore means it will treat for a long time and manage the patient. That increases the cost. That increases the burden on the healthcare delivery system. And so with the kind of healthcare delivery systems that we do have, which we are working to strengthen, if we do not properly anticipate cancer and plan for it, it could overwhelm our healthcare delivery system.